Hi, and welcome to Chapter 9. This week we're going to be learning about public health responsibilities of healthcare practitioners. So first we'll talk about vital statistics. They are collected by the government officials to assess population trends and needs. They include live births, deaths, fetal deaths, and induced abortions, and changes in individuals' civil status. So what is this information used for? It can be used for educational institutions, government agencies, research scientists, and then also private industries. And then any other organizations and individuals that would like to use this information, a lot of the times it is public for them to see. So how do they record births and deaths? There are specific guidelines that need to be followed when filling out these forms. They either need to be typed or printed. No entries can be blank. Any corrections or anything you need to erase needs to be avoided. So make sure that all the information that needs put on there is right in front of you so you don't have to fix anything. Signatures need signed wherever requested. File only the originals with the state registrars. So the originals get filed and then any copies can be saved. Make sure that names are spelled correctly because there's a process. Again, if there's any corrections or anything that need made, it's kind of a lengthy process to go through that. Avoid any abbreviations and refer any problems to state officials. Next is going to be information that is required on a death certificate. Now, this is usually filled out by the coroner or even sometimes physicians. We probably won't have to do this ever in dentistry, but we're going to include it anyways. So things to include. What caused the death itself? Was it a disease, an injury, homicide, things like that? The date and time of death, of course, is very important. The place of death. Was the patient pregnant at all, if it was a female patient? And then if an autopsy was performed or not is important to include as well. Deaths subject to autopsy. So not all deaths receive an autopsy. There's certain ones that do, though. If there's a possible criminal cause, a homicide or something of that nature that they need to prove how the patient died, they'll do an autopsy. An unattended death. So if the person dies while no one is around, they're not in the hospital, they're not sick or anything, they just die, an autopsy will typically be performed. Due to causes undetermined by the physician. If the doctor is unsure of why the patient died, they'll typically do an autopsy as well. And violent or otherwise suspicious death. So if they're thinking it may have been homicide or they're trying to rule out suicide, things like that, typically an autopsy will be done. Forensic medicine. So this is the division of medicine that incorporates law and medicine and involves medical issues or medical proof at trials having to do with malpractice, crimes, and accidents. I'm sure you guys have all heard about forensic medicine before, TV shows, things like that, where they have to identify a Jane Doe or a John Doe, an unknown person, and they may use dental records or other medical records to help to identify the person. Public health functions. So they are inferred from the 10th Amendment of the U.S. Constitution. Federalism is the sharing of power among national, state, and local governments, and public health statutes help to guarantee the health and well-being of citizens. Provisions of public health statutes. They help to guard against unsanitary conditions in public facilities. They inspect establishments where food and drinks are processed and sold. So I'm sure you've all heard of the health inspector. They make sure that the conditions are good enough and sanitary enough for the public to consume them. Pests and vermin extermination as well, to make sure that there are no animals spreading diseases. Help with water quality checks. Set up measures of control for certain diseases. And require physicians and school nurses, other healthcare workers to file certain reports for the protection of citizens as well. So enforcement power of the states. They require investigations to be conducted in infectious disease outbreaks. Make childhood vaccinations a condition for school entry. ban the distribution of free cigarette samples around schools or in areas where children are typically at, institute smoking bans or restrictions, involuntarily detain or quarantine individuals who have certain infectious diseases. We just kind of went through this with COVID recently, where they were kind of enforcing that quarantine period if you were around someone who had COVID or had it. And then last, seize and or destroy property to contain the threat of toxic substances. So these are some of the things that the states themselves have the enforcement power to dictate. The CDC. So the CDC is a national agency. They provide a variety of protective and safety services and education. We should be very familiar with the CDC in dental, as especially in PA, they're kind of like the governing body. PA doesn't have a lot of specific for dental infection control related things. They kind of all lead back to the CDC's regulations and recommendations. They also analyze data to determine solutions for disease threats, and some examples of services include notifying public of a food poisoning outbreak, things like that. If a large group of people suddenly get ill, the CDC kind of sends out messages about that. If you remember from COVID, they were heavily involved in like keeping track of daily numbers of COVID in areas where there were surges, things like that. Next, we'll discuss reportable diseases and injuries. So each state determines how and when these diseases need to be reported. Sexually transmitted diseases are typically reported when they are diagnosed. So the physician or doctor that diagnosed them is going to report that a patient has a sexually transmitted disease. They usually don't go into specifics, such as their name or any identifying characteristics that would go against HIPAA, but they are going to report to the state that a patient came in with this STD. Those who are diagnosed with HIV are instructed to notify their past and present sexual partners or anyone that they may share a needle with. If they do that, it's kind of up to them if they do it or not, unfortunately. So a lot of people are too embarrassed to share these details with others, and it does not end up getting notified to anyone. Next, communicable diseases are more stringent for those who work in the public. So doctors, nurses, dental assistants that are working in any clinics or anything, if you come across a communicable disease that you may have think came from a patient of yours or someone in your office, it's really important to report those as well in case there is an outbreak associated with it. So some examples include mumps, pertussis, or rabies. Vaccine documentation. So when vaccines are administered, there's a lot of documentation that needs to be kept track of and submitted kind of to the manufacturers of the vaccine so that they know who received them and when. So number one, the date the vaccine was administered, the vaccine manufacturer, the vaccine lot number, and then the name, address, and title of the healthcare provider who actually gave the patient the vaccine. There is an adverse effects reporting system for vaccines. So any event listed that could be considered a vaccine injury needs to be reported. Any contraindicating event listed in the manufacturer's package insert, so any adverse side effects and things like that that may have occurred, rashes, allergic reactions, things like that. That way that the manufacturer of the vaccine can see if there's an issue somewhere with their product or anything that may be of concern that they may need to pull it for a little bit until more research is. Next, we have reportable injuries. So these are types of injuries that may occur that we sometimes don't even think about needing to report if we suspect them because we aren't sure if they are actually happening or not. So examples of this would be assault. If you are suspecting a patient of yours has been assaulted, ideally it's to be reported. Any rape cases, obviously it should not be happening in front of you, but if a patient is telling you that they may have been raped, it's often in their best interest to either have them report it or report it to the police yourself. And then domestic violence as well, which can be child abuse, spousal abuse, elder abuse, or even abuse of an unborn child, all falls under domestic abuse. So things like that should be reported as well to the police to make sure that the person is safe. So what are some signs of abuse? There's physical signs, unexplained fractures, repeated injuries, burns, friction burns, bite marks, malnutrition or dehydrated, they just don't look well, possible sexual abuse as well. And then there's also behavioral signs, such as an illogical explanation for injuries. They can't really tell you how they got an injury, or if they do try to tell you, it's just not making sense why the injury would look like that. Frequently changing physicians because they're fear that the doctor may catch on to what's actually happening, so they just keep going to new ones. And then also changes in their appetite. Next, we'll talk about drug regulators. So the FDA, the Food and Drug Administration, is the main drug regulator in the United States. They are within the Department of Health and Human Services. They test and approve prescription drugs. There's also the DEA, the Drug Enforcement Administration, which is a branch of the U.S. Department of Justice, and they regulate the sale and use of drugs. Next, we will talk about the Controlled Substances Act. I'm sure we're all vaguely familiar with this act, as it is used in dental offices when prescribing medication, as well as hospitals, doctor's offices, anywhere really in the United States. So there are 5 categories based on how much potential a drug has for abuse. So Schedule 1 means that there's no currently accepted medical use. Things like heroin, LSD, ecstasy, even marijuana is technically in this category right now. A Schedule 2 drug means that there's a high potential for abuse. Things like morphine, oxycodone, things that people usually will get addicted to. A Schedule 3 means that there's a moderate to low potential for physical and psychological dependence. So we're starting to get lower and lower with each schedule that we go. Things like anabolic steroids would be on this category. Then we have a Schedule 4, which is a pretty low potential for abuse and a low risk dependence as well. So things like Valium, Xanax, Darvon as well. And then lastly, we have the Schedule 5, which is the least amount of abuse potential, including cough medicines with codeine. So still a small potential for abuse, but definitely not as much as some of these higher categories there. Medical and recreational marijuana. So there is a difference between the two. Medical marijuana, there's currently 37 states that have laws allowing medical marijuana. That's as of November 2021, according to the book. I'm sure there's many more that allow it at this point in 2024. There's also recreational marijuana. Only 18 states and 2 territories and Washington, D.C. allow recreational marijuana use as of November 2021. Again, I'm sure the number is a bit higher now. It's starting to become more accepted all across the United States. But there is a bit of a difference. So, like in Pennsylvania, you can now get your medical marijuana card. There's dispensaries all around. There's one right up the road here from the college. So you may start to see this more and more. And it kind of will get out of that Schedule 1 category as well, since it's being allowed more and more. But of course, each state has different laws, so whatever state you're in, you need to follow those laws.